Really sad story out of Brampton, Ontario. A 13-year-old girl has become one of the youngest people in this country to die of COVID-19. Emily Vegas tested positive for the virus, along with her sibling and her mother, who remains in hospital. The city's mayor, Patrick Brown, tweeted out, "This is beyond heart-wrenching as a parent. I am lost for words. Horrifying. We can never underestimate the seriousness of COVID-19 and the variants. My deepest condolences on behalf of the city of Brampton. Rest in peace, Emily Victoria Vegas." With more, I want to bring in Dr. Shelly Dev, an intensive care physician in the Department of Critical Care Medicine at Sunnybrook Health Sciences Center. Doctor, good morning. Thank you
Good
for
morning.
being with us. I want to, first of all, get your thoughts on this incredibly tragic story out of Brampton, a 13-year-old girl dying at home. What are your thoughts around this when we see someone so young dying from this virus?
Um, the thoughts are coming from being a physician who a loss of a patient is devastating. A loss of a child is a whole other thing. As a parent, just the worst possible thing that could happen to you. And then this, you know, um, it's so awful that you end up being humbled and informed by tragedy. And this is what we're all worried about, right? Is that if you we've been saying, pretty much consistently the same thing, that especially with the third wave, this is a new illness. This is not the illness from a year ago. This is just vicious and unrelenting and indiscriminating in terms of age or prior health conditions. And it's just, it's so sad and upsetting that it takes tragedy to sometimes have a message resonate, because that loss is too big for us to take the message.
Yeah, I hear you on every word, and I think it also shows how random this virus can be, because everybody in the family got it except for the dad, who was out working. He was an essential worker.
Yeah, it's you know, I've said this before. I so wish I could, or and my colleagues feel the same way, especially those at the science table. Wish we could say this is the recipe for you to avoid getting ill. And usually we can do that in healthcare, right? It's like eat healthy and make these
Yeah.
choices and you'll ensure your longevity. And this is just not one of those times. And this just goes well beyond uncertainty. We're having to tolerate uncertainty in medicine a lot, but this just goes beyond this unbelievable degree of helplessness. And what I think is really important is to reintroduce some sense of control back to the individual person. And that control truly is those things we've been talking about for a year, which is if you mask, if you socially distance, if you're prudent about those decisions, that is a decision you are making to help yourself and everybody around you. That's a willful choice. That is the only control we have, right?
Let's talk about what's going on in ICU. We know the numbers are up again. We've
Hmm.
heard, I think for the last week or so at least, maybe a little bit longer, that we should expect that. They were these numbers were going to be baked in. It was going to take some time for the lockdown to have a positive impact. Can you describe for us the situation right now at the ICU where you are, and how all of you are coping with it?
It is really, really physically and emotionally and psychologically very difficult. And medicine is hard on its easiest day. This is different. It's it's it just doesn't stop. And what I really think is important for everyone to know is I've heard from a lot of people that there's this disconnect about, we talk about numbers and it's very abstract. It's hard to imagine what that is, right? It's hard to imagine what an ICU even looks like with all these people on all these machines. It's not just COVID patients, it's everybody. It's people who haven't been able to see their doctor because of cancellations of sorts. It's people who've been afraid to come to see their doctor. It's people who put off coming in because they're heeding the warnings of, not coming to the emerge if you don't have to, whatever. So what we're actually seeing is the consequences of delayed presentations of illnesses. And it is just stunning. Like it is unbelievable the extent to which everybody is suffering. So I think it's really important for us to say, of course, COVID is something we must be very afraid of and must be prudent about in terms of protecting ourselves and everybody else around us. And then there's everybody else who doesn't have COVID,
Mm.
where there's an enormous number of people, like it's all of us, who have mental health struggles, physical struggles that are putting off these things because the healthcare system, in terms of the way it is not the way it used to be. We don't go as easily to the emergency department or see our family doctors as we used to, or our specialists. And so that's why this is universal. It's not just about COVID, it's about the consequences COVID has had on everybody else, including in terms of their health. That is just stunning. So that's really difficult to get your head around. And I've said this amongst my colleagues before. If it wasn't so difficult and heartbreaking and exhausting in terms of the efforts people are putting in, if it wasn't all those other difficult things, it would be so touching and
Mhm.
moving and inspiring. Like I can't every day I'm so overwhelmed by what my friends are doing. Like it's just and we lift each other, we lean into each other because we only have each other. This is the only communal place we go, right? I mean, we are fortunate. We get to go to work. We get to, put our efforts towards helping. That's an enormous privilege. Um, and it's just, I'm speechless about the people around me and their fortitude and their goodness and their commitment. It's something like again, if it wasn't so heartbreaking at time, it would be just so inspiring.
Do you see some light at the end of the tunnel that keeps you going? Is it the vaccines? I know a lot of medical experts are really, despite the controversy around Johnson and Johnson, happy that it's arriving because it's a single dose. It's easier for people to get. What is it that keeps you motivated and keeps you going?
Um, my friend, this is a very difficult question. um, I have to say, this has been really hard for everybody, and I'm no different. And I have set my expectations within each day, and that works for our family. It works for my sons. Where I wake up and I say, okay, today, what are we going to do today? What is my hope for today? Of course, in the grand scheme of things, I hope for better times and I hope for everybody to be vaccinated and for us to see each other's faces and come together again. But I'm really struggling with where to put that expectation and how reliable that is in terms of a time point. And what helps me, and if that helps anybody else, is every day. It's every day. What's today? And that's what's helping me get through.
I am sending you every positive vibe I've got. Plus, Dr. Shelly Dev, thank you so much for taking the time to speak with us this morning. I know that you are super busy and we appreciate you sharing your experiences with us. We'll talk to you again. Again, wishing you all
Many
the best,
thanks.
okay?